All right, I think it looks like the majority of people have come in, and then as I hear the chimes coming, perhaps I'm being contradicted, but we'll go ahead and get things started here. I want to welcome everyone to our May Learning Cafe entitled What Does Success Mean Anyway? Promoting Successful Transitions for Youth Aging Out of Custody. We have Amy Gorniak here from the Vanderbilt COE with us. Before we get things started, just a few housekeeping things. First, at the end of the presentation today, we'll be putting a link in the chat box for an evaluation. We do ask that you complete that evaluation, not only so you can get a certificate, but so we can know what you liked, what you didn't like, what went well, what didn't go well, and so forth. And then after completion, you'll be getting a certificate for attendance there. You'll also find that you're all on mute. That's on purpose because there's so many people here. We want to make sure that there's no background noise. So I'm going to encourage you all to please stay muted throughout the presentation unless there's a question that needs kind of a conversation. Otherwise, please submit all questions through the chat box and I will moderate those to Ms. Gorniak throughout the presentation or at the end. So if you'd like a copy of the slides, we will also have those available to you. Just email Karen Gray or Rachel Needham, and I'll encourage, actually, I know Karen Gray's on the road, so I'll have our clinical case manager, Rachel Needham, put her email in the chat. And so you all can just email her, and once we have the slides, we'll be happy to provide you a copy of them. So without further ado, I'd like to introduce everyone to Amy Gorniak. She is currently finishing her doctorate of psychology through University of Houston Clear Lake as a predoctoral intern at the Vanderbilt Center of Excellence. She has been working with children, teens, and families coping with trauma for over a decade. First within the Child Protective Services system in her home state of Texas, and then as an LPC working with families and children in crisis and community mental health centers, Head Start, and early Head Starts. She is passionate about her work and research into the intersection of social emotional learning and ACEs in children and their parents. So I'd like to introduce everyone to Amy Gorniak and let her take it from here.
Good afternoon. Thank you so much for joining us today. I'm going to be talking about supporting success for our youth aging out of care, a subject that's really important to me personally and professionally. I think a lot of us have had the experience of having a youth who is really close to that age of transition or has just transitioned out of care and being unsure how best to support them. According to the US Department of Health and Human Services, of the more than 288,000 youth exiting foster care every year in the US, about 23,000 of them are youth who are aging out of foster care without relational or legal permanence. And these youth are at really high risk for a whole host of difficulties. And so I wanted to start off by just kind of reviewing what we know about what those outcomes look like for transition age youth in the United States, and a little bit about Tennessee as well. We know that transition age youth graduate at significantly lower rates than their peers, complete high school across the lifespan at significantly lower rates, and are much, much less likely to enroll in college or receive a bachelor's degree by age 25. At the same time, studies have shown that a significant percentage of transition age youth report intending to graduate high school and enroll in college. There was a 2006 study that found that 80% of the transition age youth surveyed expected to finish their diploma before they exited foster care. 92% wanted to pursue either vocational training or college, and 53% wanted to attend a four-year university. But looking at the data, it's really clear that we're not seeing that level of educational engagement. And at least part of that is related to one really specific problem that's very common for our youth, and that is frequent school changes. According to the Casey Family Programs, they did a 2010 study, and about 2/3 of foster alumni had changed schools a minimum of 7 times between kindergarten and 12th grade. There was another 2018 study on 1,400 youth that found that an average of 13 different placements were held by each youth during their time in care. And each change in placement comes with a risk of moving schools. School mobility has been associated with reduced academic performance, not least of which is the problem of obtaining complete school records for foster kids. And some studies indicate that for every change in school, foster youth end up approximately 4 months behind where they should be in educational attainment, So if we've got youth who are changing schools 7 times, we are really creating a deficit in their academic skills and engagement. In addition, foster youth are up to 7 times more likely than their peers to be retained 1 or more grades in school, and simply being in foster care, so no placement moves or anything like that, predicted a 7 to 8 percentile decrease in test scores in one 2011 study of academic performance for foster youth. They're also between 25 and 50% more likely to be in special education for any reason at all: cognitive, learning disabilities, social, emotional, or behavioral. We also see really significant differences in employment for our transition age youth, especially in earnings, which is a reflection of their greater likelihood to have only part-time or shift work and to experience multiple disruptions in employment. One 2017 study found that unemployment and underemployment were made worse for transition age youth having difficulty accessing material goods, transportation, regular access to a computer, cell phones that could help with obtaining and maintaining employment and accessing employment-related services. Another example, there was a 2018 study by Thompson and colleagues that found that of 127 former foster youth, only half had state IDs at the time that they exited care. Only 24% of them could drive. And a National Youth in Transition database study found that just 22% of transition age youth had ever attended vocational rehabilitation programs or employment training programs. And these services were unevenly distributed by state. Here in Tennessee, less than 2% of our transition age youth receive employment or vocational program resources at or after transition from care. In that same review by the National Youth in Transition database, they found that 29% of transition age youth at age 21 had experienced some form of homelessness. The protective factors in that study against homelessness included having connections with a supportive adult, remaining in foster care to age 21, completing high school education, being actively enrolled in school, and having a full-time job. All things that we've just talked about being less likely to happen for our transition age youth. And when transition age youth become homeless is especially troubling. One study found that 20% of these youth went directly to a homeless shelter when leaving foster care. 20 to 22% of all foster care alumni reported homelessness for at least one day in the year after aging out of care in one Casey family study. And a 2019 study by Prince and colleagues found that at age 19, 20% of transition age youth had already been homeless at least once in the prior 2 years. In 2003, Riley found that out of 106 transition age youth, 6 months after aging out, 1/3 had had to move 5 times or more, 60% lived at more than one address, and youth in that sample had moved up to 16 times in that 6-month period. So we're seeing a lot of home instability that directly relates as well, another study found, to difficulty maintaining or securing stable employment, as movement in residence makes it harder to maintain transportation and access to current employment. Legal involvement is another area of concern for these youth. Shook and colleagues in 2013 found that while rates of criminal involvement for transition age youth and former foster youth are pretty similar, there's significant differences between these groups and emerging adults who are not part of these groups. They also found that there's a 7% increase in likelihood of juvenile justice involvement for each additional foster placement a youth had while they were in care. And youth who had run away while in care were 2 times as likely to be involved in juvenile justice than youth who had not. There was a 2001 study that found that 27% of male and 10% of female foster alumni had been incarcerated at least once after exiting care. And a study by the Every Child Foundation in 2006 found that 70% of all state penitentiary inmates in California had been in foster care in their lifespan. National Youth in Transition database reported that of the 14,000 19 to 20-year-old transition age youth surveyed, 22% had been incarcerated in the prior 2 years, so at 17 and 18 years old. And Riley in 2003 found that legal involvement is also directly linked to homelessness for these populations. almost 25% of the transition age youth surveyed had dealt drugs to earn enough money to pay for basic bills like housing and utilities, and 10% had paid bills directly through the provision of sexual acts. They further identified that lower educational level was one of the biggest factors in increasing the likelihood of being incarcerated at any point for these youth. In terms of mental health and substance use, I don't think any of us are surprised. This data came from Shook and colleagues' study in 2013. It looked at over 42,000 youth, 1,300 of which were transition age youth. They had higher rates of services across the board, not only in comparison to other emerging adults who were never in foster care, but also in comparison to other former foster youth who had found permanency in some other method than aging out. Havlicek and colleagues in 2013 found mental health diagnoses occurred for between 61 and 66% of transition age youth by age 17 and 18. But same age peers who were former foster youth who had other forms of permanency had rates closer to 57%. And 32% of transition age youth would have more than one diagnosis, 23% having comorbid mental health diagnosis and substance use disorders. That same study found decreasing rates of service utilization, especially in medication for our transition age youth. So about 36% of them at 18 were taking psychiatric medications, but the percentage doing so dropped steadily to 21% by age 20 and 10% by age 21, even though those medications were still necessary and those diagnoses still applied. A 2006 study found in a sample of transition age youth that 20% endorsed alcohol problems and about 30% endorsed drug use problems, and that foster youth were 1.5 times more likely to use alcohol, 3.8 times more likely to have alcohol dependence, and 2.4 times more likely to use illegal drugs. And unsurprisingly, homelessness in this population is also directly tied to mental health and substance use. Our transition age youth who have any form of mental health diagnosis make an average of $9,000 less a year in one study than transition age youth who have no diagnosis. And homeless transition age youth were more likely to use heroin or methamphetamines and to exchange sex for money or drugs than homeless youth who were former foster youth or had never been in foster care. I think in terms of physical health, most of us have probably seen the ACEs study data at least once at this point, and we see a lot of that data echoed here. A variety of health concerns and health risk behaviors occur in larger percentages in our transition age youth. In addition, there's one study from 2014 that found that about 40% of youth who age out of care instead of finding other forms of permanence have at least one medical problem that requires ongoing medical care, and access to that care is a real issue for our youth when they age out. So when we think about supporting success for our youth transitioning out of care, we have to really think about our risk and protective factors. And unfortunately, a lot of the research literature, all that we just talked about, is really specific to the negative outcomes in this population. It focuses on the link between foster care and those negative outcomes. And it's really difficult to separate the challenges of early childhood adversity and experiences in foster care from those outcomes. There has been a little bit of research, though, in what might be protective steps to take. A lot of it is qualitative, and I'd like to talk about some of that now. So a review of the literature that was done last year found that there's only 79 programs that focus on transition age youth named in the research literature. And of them, only 10 programs could be considered some level of evidence-based. None of those programs, by the way, target LGBTQ youth or our youth who are parents, both populations that are common, or both attributes that are really common in our transition age youth. And none of the programs that we find in the literature were rated as being well supported. And there's a lot of reasons for that. One of them is that most of our programs for transition age youth are locally developed, and they're implemented on a local level. And if program evaluation does happen, that information isn't often disseminated. In addition, many programs have just one study conducted, so we don't get to see the program's effectiveness with more than one sample of youth. And many of these programs don't look at outcomes over time. I don't want to spend a whole lot of time here, but I do want to point out that these programs are largely focused at either creating opportunities for foster youth and transitioning youth to access services like extended foster care, or providing expenses with a first month rent, or in building really specific knowledge or skills. A few focus on building relationships, but very few provide concrete material assets or more intangible supports. And we can see that most of them have really just one study comparing them to a control group, and very few have outcome data at even 6 months after treatment ends. And this is really a concern when we're talking about looking at outcomes for a group of people transitioning into the rest of their adulthood. Most of our housing and health service programs that this study found named in the literature as being some form of evidence-based are systemic. They focus on creating relationships between agencies, are informational, or provide very, very limited assistance. I do want to point out that the Youth Villages LifeSet program is rated as at a 2, and that means that there was at least one randomized clinical trial, and they did 6-month outcome follow-up data to support its usefulness. Better Futures is also a 2 and focused on helping youth feel more empowered in making their own healthcare decisions. So these are the kinds of programs that we want to start looking for and bringing aspects of into our own program development. In terms of building stable relationships, we see that none of our transition age youth programs have outcome data post-study that was also rigorously conducted. And that's, again, concerning because we're talking about a group of programs that's oriented towards specifically creating stable, lifelong relationships. In addition, one of the programs had absolutely no effect. So this is an area where we really particularly need to see some growth. And the reason for that is because social supports are one of the most important things in the literature for our transition age youth. Klondike and Samuels, in a 2020 study, found that youth aging out of care often appear really strongly self-reliant, and that this is actually related most often to significant distrust of adults and unwillingness to seek support rather than actual skillfulness. One of the central aspects of this period of life is the role of relationships in healthy development. Relationships with caregivers acting as a buffer against risky decision-making and behaviors, relationships with caregivers, mentors, and peers that mirror back a really positive sense of self and nurture a healthy identity and intimacy with other individuals and community. Supports don't have to be just formal. They can also be informal or more natural mentors, as well as programmatic. And mentorship in particular has been studied in regards to successful aging out of care. Natural mentors are those sort of helpful, really supportive, non-parent adults that youth can self-select from their sort of existing natural environment. And a systematic review of the literature on natural mentorship that was conducted in 2016 found transition age youth who had natural mentors had better physical and mental health, higher levels of education at their time they left care, greater resilience to hardships that occurred during transition, and had accumulated more assets than their peers without natural mentors. However, about half of youth aging out do not have any natural mentors. And this study is not the only one to find benefits. A 2010 study found that having mentors made transition age youth more likely to complete high school or a GED, and that these youth were less likely to be homeless than youth who did not have mentors. Several studies also have found that having mentors increases likelihood of attending college, being employed, and having stable housing. In fact, mentorship and peer relationships in one study in 2014 was identified as one of the primary ways that youth who are experiencing housing instability manage to avoid homelessness. So these relationships provide across a range of benefits and in a range of life areas before and after transition. And when we think about social support and what makes a social support valuable, one study that was published in 2020 found that the social supports that were most helpful to transition age youth had several qualities in common. They were consistent and dependable. They were durable. They persisted even in the face of challenge and pushback from the youth involved. The adults were committed to being long-term members of this youth's life, and were open and accepting, showing up authentically themselves, and focused more on being positive and encouraging than on providing constructive or critical feedback. Workers in the foster care system who saw their foster youth as, and this is a quote from the literature, valuable human beings who approached their role with a focus on possibilities for the future and promoted close bonds, had youth on their caseload who had overall greater well-being in multiple domains when they transitioned. And a 2009 study found that relational permanence, this having caring adults in your life who stick around, can actually be as valuable in promoting successful outcomes as legal permanence is. This means that we need to be thinking about ways that we can promote the idea of family that move beyond just biological and legal definitions when we work with these youth. In addition, the sense of belonging that comes with mentors and social supports positively impacts both our transition age youth's overall sense of subjective well-being and their long-term academic achievement. However, looking back at that National Youth and Transition Database study from 2016, less than 1% of our kiddos in Tennessee receive any form of mentoring before they age out of care. And one study of youth who did have mentors found that most of them had people to give them advice and constructive criticism, but no one who provided emotional support. And the youth least likely to have mentors, especially supportive mentors, were male and Black. In terms of asset building, we think about what role a parent would normally play for our kiddos. So there's a study from 2007 that shows that between the ages of 18 and 34, most parents provide about $38,000 worth of assets to their children to help with income, schooling, housing, all those kinds of things. And up to age 24, about 2/3 of adults continue to live with a parent or other relative. So our kiddos are aging out of care and often don't have access to these kinds of supports and struggle for many years past aging out due to a lack of some of these basic assets. So material asset building is one of the things that we can really encourage and recommend and support when we're working with these youth. There was a 2020 review of the National Youth and Transition Database that found that youth receiving budgeting and financial education services were about 5 percentage points more likely to receive financial aid, about 10 percentage points less likely to be homeless, and those who receive post-secondary education services were about 13% more likely to receive financial aid and 8% more likely to be currently enrolled in school, 7% more likely to be employed at least part-time. However, they also found that only 29% of youth get financial education services, and only about 20% get post-secondary education services. I think most of us have probably heard of the Chafee Foster Care Independence Program. It's existed for more than 20 years. There's only one review of outcomes that's ever been done, looking specifically at its independent living programs. And it did show that in the review of their asset building services, youth who received this assistance had greater financial stability and housing stability, as well as better mental health than those youth who did not. Another set of factors that promote success are a lot less tangible than assets or even social networks. These are characteristics like self-efficacy, self-esteem, personal characteristics like assertiveness and independence, and having a sense of hope and expectations for the future. Transition age youth have consistently across studies been found to have lower self-esteem and poor self-efficacy regarding their ability to succeed after they leave care. At the same time, we know that life satisfaction for our youth exiting care is predicted directly by that personal sense of self-efficacy and self-esteem, and that label of life satisfaction in one study remained stable across both 1 and 4 year periods post-exit from care. A 2019 review of the literature on some of our independent living programs found that directly teaching skills like leadership, self-determination, can actually enhance not just a sense of self-efficacy, but also then our educational and housing outcomes for those in independent living programs, including increased likelihood of graduating high school and attending college. There was a qualitative study that was conducted that found that foster youth who had developed certain attributes were more likely to be resilient in their educational achievement if they did pursue post-secondary education. So when they had difficulties navigating the system, completing the work, they were more able to seek help and support and succeed and overcome those difficulties. And those included these intangible attributes like assertiveness, a sense of determination, and a flexibility and being able to choose, I'm going to make a decision in this moment, even though it's hard.
Amy, there was a question a few minutes ago about is NYTD the source of this Tennessee data?
Yes.
Thank you.
So if I have referenced specifically Tennessee, it's been from the NYTD database, specifically a review of the information that was conducted in 2016. And looking at, I can include a slide when I send this out that has the 2018 fiscal year data as well for some of these things, specifically for Tennessee, and it's not exactly improved. So yes, that is where that comes from. As we work with transition age youth, then just these aspects, purposefulness, resilience, a sense of self-regulation, and these basic intangible skills can often get lost, especially when we're working with their foster parents, their caseworkers we're really focused on those very concrete. We need to have housing, we need to have employment, we need to have education. And what the research is telling us is that these areas are really big supports in actually having success in completing our education, in accessing post-secondary education, and in those longer term outcomes around employment and financial stability. So some of us may be caseworkers or otherwise involved with DCS, but I want to turn attention for just a moment to what transition planning actually looks like here in Tennessee. And some of the options for formal programmatic supports that are available in the state to our foster youth. So there are two routes, and some of this might be review. There's extension of foster care, or there is transition support through the Youth Villages Transitional Living Program. There are also a variety of resource centers that exist throughout the state that can help youth regardless of which path that they take. And our workers who are involved with these youth should be making a variety of referrals at this time as well. When it comes to extension of foster care, this is a voluntary program. Children have to opt in to extend their foster care at age 18. And they also have to meet one of three criteria. So they either have to be in high school or GED programs. They have to be enrolled in vocational or post-secondary education. And these kiddos can get housing support, insurance, help with graduation and extracurricular expenses. There are some scholarships, things like that. The other group is our eligibility C, and these are often the kiddos that it's a little bit harder to find services and supports for. These are our kids who have a serious disability that prevent full-time employment or school. There are a lot of options available for these kids, housing and other supports, with a real goal of bridging to adult community support services rather than to promoting that very independent living on our own. All youth as well are eligible for TEN care up to age 26, thanks to the Affordable Care Act. And youth can re-enter care anytime up to age 21, as long as they meet one of these criteria. Also, some of our kiddos who are in subsidized permanent guardianship or whose families receive some post-adoption assistance can continue to receive assistance and qualify for some of our independent living services. So if you're working with families who have adopted and the kiddo is struggling and needs some services and supports, there are some options for independent living supports for them. Youth Villages, on the other hand, works with youth up to age 23, unlike extension of foster care, which ends at age 21. And their supports can also be available to some of our youth who are 16 or older, who were currently at the age that they age out or previously in a youth development center. So also some of our juvenile justice youth. And the plan itself is initiated at age 18. So these are our life skills assessments. Any youth who comes into care at age 14, at age 14 or older has to have one of these completed within 14 days. And it should not just be the caseworker involved. So all of the adults in a child's life should be involved. And when they're first coming into care, if they're over the age of 14, this does need to include biological parents, school faculty, all of these individuals who know a lot about this child and can offer support. And the plan has to look beyond just our official programs and supports. It shouldn't just say they're going to extended foster care or they're going to go through youth villages. It also needs to look at other developmentally appropriate activities. At age 14, 15, we need to be including in there information about what are our roles and goals around dating and romantic relationships and learning healthy boundaries? What kind of extracurricular activities and hobbies and leisure activities are we engaging in? What do our peer relationships look like? All of those things are supposed to be included in this assessment. And it's based on the IL strengths and concerns indicators and TFACs. One of the complicating factors is that those are based on the custodial permanency plan. So when we have kiddos with unclear permanency plans, it makes it a lot harder to develop a really good, high quality, independent living plan. And this is part of why the TFACs process needs to be approached really thoughtfully by those who are engaged in this with our kiddos and families, because it becomes the basis for all of our life skills assessments and transition planning for these kiddos. In addition, these plans are supposed to be under the direction of our kiddos increasingly over time. So from the very beginning at age 14, we should be having discussions with the kids themselves about these. And we should be scaffolding their involvement and active participation, helping to develop the autonomy that they're going to need as they move towards adulthood, and doing it with support. The plan has to be personal to the youth and detailed, with really specific actions that will be taken to help a youth learn independent living skills. And the plan should include identifying specific resources, steps, and deadlines, as well as who's going to be actively taking over the outcome of that kind of skill or area of growth. And the independent living skills assessment is updated on the same schedule as the permanency plan. So if you know kind of the timeline of the case of the kiddo that you're working with, staying in touch with the caseworker, asking for those updates over time can help you not only to better inform this plan, but also to be able to talk about it over time with the youth that you're working with. And there is a guide that you can access online that provides some really specific questions to consider and topics to explore over time. This is an example of kind of what that plan looks like, the questions that are asked in filling it out, and they're used in each of the 9 areas that are involved in the transition planning. Life skills and health skills have to be addressed at age 14 and beyond for everybody, but other areas like communication and transportation and education and housing are addressed as needed as we get closer to age 17. These kind of questions can make really good guides for us as well. In therapy, we might modify them to talk with our clients about specific skills and goals. And in an assessment or a consultation environment, these might be questions that can guide the kinds of recommendations that we make. And the more of these questions that the team and the youth can answer, the more helpful a given recommendation or path forward is likely to be for them. I know when we at the Vanderbilt COE do an assessment debrief, we make some time there to staff questions that the DCS worker, the resource parent might have, and encourage follow-up consultations that can be guided by these kinds of concrete planning questions. So Tennessee resources, the first 2
I'm
sites
over here,
are
Tallulah.
general information on a variety.
All right, Mimi's going to turn your movie off.
Extension of foster care until age, and then the other gives us information about teen care. Again, kiddos qualify for teen care up to age 26. And if you're working with a youth who isn't certain about this information, it may be helpful to sit down with them, because application and reapplication goes through the healthcare.gov healthcare marketplace, and just help them learn how to navigate that system. And then this last takes you to information about Head Start in Tennessee. Our youth exiting care as parents are really likely for their kids to qualify for early Head Start and Head Start. These programs provide a variety of supports and resources specific not only to parenting, but also to things like housing and mental health and other needs. So if we have youth aging out of care who are themselves parents, these are some of those programs that we really want to think about getting those youth involved in if they still have custody of their children. This slide, and all of these slides are going to be included when you get the slides, contains the contact information for all of our major independent living services resource centers across Tennessee. There's one in Memphis, one in Nashville, one in Chattanooga, and one in Knoxville. And then some specific programs for youth without disabilities. Youth Villages Life Set, which we mentioned earlier and was one of our programs that has really good evidence-based support, is an intensive community-based program. It acts as a bridge from foster care to adulthood for people who turn 18 in foster care. And it's very comprehensive. It looks at relational permanency, housing, mental and physical health, both self-advocacy in those areas and making sure that we're accessing those services, career and employment, life skills, and education. We also have, for those in some specific areas of Tennessee, the Crossville Housing Authority in Crossville, Tennessee has independent living housing and apartment complex for youth transitioning out of DCS custody. They also provide housing vouchers for those who qualify based on income. And the Chambliss Center for Children in Hamilton County offers transitional living housing programs for youth in extended foster care and can help enroll our children who are parenting in early Head Start, our transitional youth who are parenting their children in early Head Start and Head Start. For our youth with disabilities, and I know in my experience, these are often the cases that I feel most stuck on, whether that is cognitive or mental health disabilities and concerns. We have the Community Targeted Transitional Support Program. It works with those who are receiving treatment for a mental illness or with a co-occurring substance use disorder to provide assistance receiving necessary medical care, psychiatric care, and help paying for rent or utilities on an as-needed basis. The Choices program offers a lot of different supports for people specifically with intellectual and developmental disabilities across the lifespan. This includes adaptive skills, employment, and residential services. And they offer services both for those who can't remain with their foster families who need housing and for those who do have a stable placement in extended foster care, but whose parents need additional support services. So they offer a variety of supports in the home and in the community, not just in their kind of group home and transitional centers. So in addition to some of these official kind of programmatic supports, there are other things that we can do in our unique roles to support positive outcomes for our transition age youth. And I really want to emphasize that as we think about these things, one of the most important things to consider is that we should be doing this really early. If a 13 or 14-year-old comes into care and ends up going home to their parents rather than aging out or gets adopted, they're not going to be harmed by people they interacted with in the system, making the effort to support them in learning independent living skills and self-advocacy and building healthy relationships. We all have to do these things in adulthood. So whether a youth ultimately ages out or not, these are things we can and should be starting before transition, long before transition is an issue, and scaffolding and building over time. When we think of our roles, how we can support these skills, we can really be guided by the idea of the zone of proximal development. So Vygotsky developed this theory that indicates that really learning happens best when we start a little bit between what someone can already do and what would be too challenging for them. We want to identify where our youth are currently at very specifically, what they can do well, what their strengths and challenges are, and then identify what that next thing is. The next step in a complex series of steps for a given task or the next level of understanding or applying idea or place to generalize a skill. We want to engage the youth in doing that with supports. So we ask what they can do easily, and we look at that next thing that they can do, not where they're going to give up in frustration, even with someone helping them, but where they could stretch to do with support from a more knowledgeable person. That's that zone of proximal development. And the support from a more knowledgeable person provides that scaffold or framework that we can use to foster learning. And we want to be really thoughtful about this, because if learning is too hard, we can actually provoke so much anxiety in our youth about developing these skills, who, thinking back to our research earlier, often have very low self-efficacy anyway, that we actually make it a lot harder for them to learn. They do their best when we both don't make it too easy and don't make it too hard. And there was some expansion done on this research recently, where thinking about that key role of social support, we now know that it's not just us, not just the knowledgeable adults in a person's life or our kiddos' lives who can help scaffold in these zones of proximal development. We learn as well through peers with equal levels of knowledge, sharing what they know, through supporting another learner who's not quite as developed as we are, or through working alone with learning strategies. So identifying that zone of proximal development and using a variety of social relationships to help support and teach skills, and to build self-efficacy by allowing and encouraging our youth to also support and teach skills for themselves, to be a mentor to somebody, can be really effective in supporting skill building for our youth as they transition out of care. And of course, this also means that one of the things we need to be teaching is learning strategies themselves, right? As clinicians, when assessing or treating a youth 14 or older, both the life skills assessment and any school IEP, transition plans in special education are really good information to request prior to engaging in that assessment or therapy. And if we're in therapy, I mean, even an assessment, asking the youth about specifically, what do they know about their plan? What are their thoughts about it? What are their fears and worries? This can also be brought up in consultation with all of the child serving team and with other clinical providers like psychiatrists. And we really would benefit as clinicians from remembering that one of the skills we want to foster is that self-efficacy. And so engaging actively in assent-getting processes at every step of treatment, at every step of assessment, can help to scaffold that decision-making and that sense of self-advocacy in medical and psychological treatment environments, right? We want to teach skills that support skills in other areas, basic competencies that are useful for everyone to have, like conflict resolution and setting boundaries. And we want to continually ask about and consider transition-specific aspects of the youth we work with. And we might want to make them really explicit in our own treatment plans. There's one other thing that I think is important for us to consider as clinicians, particularly given the number of youth who, often because of homelessness, but not only because of that, end up re-engaging with or returning to their bio family. And that's normalizing the desire to have a relationship there and exploring with our youth what the pitfalls are in seeking a relationship like that, where they know they might need to set boundaries at the outset, and how they can choose to re-engage in more healthful ways as adult children of their parents. Even normalizing that all children go through this process of renegotiating that relationship with their parents. So what they do is both normal and more complicated because of the nature of those relationships, can help reduce some of that sense of this being one more thing that makes them different from other children or youth their age. We can make recommendations for our foster care workers. They're the ones who are holding much of the story for our youth, and also one of the major models that retain consistently part of their lives through their journey in care. One of the good things about being consistent in that role is that they can use that to model caring, consistent, supportive relationships that include really being intentional about teaching emotion regulation and boundaries through doing it actively in our relationships with youth. And there's actually a study from 2007 that found that that kind of modeling by caseworkers actually predicts youth staying in extended foster care, because foster care workers become associated for those youth with being sources of support, it also encourages youth to engage in help-seeking behaviors and provide some of those corrective emotional experiences that give our youth a sense of there can be trusting, supportive relationships in my life with adults. They want to prioritize, natural mentors and positive peers from both before and after entry into care. And we really want to be intentional when we think about things like placement changes and school changes in supporting our youth in accessing ways to maintain those relationships so that we continue any natural mentor relationships that were developed in any given school or other environment that our youth were in over time. So being really thoughtful about how we gain contact information and maintain those relationships is really, really helpful. And I really want us to think about ways that as caseworkers, as clinicians, as assessors, and other advocates, that we can support our resource parents, because they're some of the biggest players in our kiddos' lives. So these are some of the areas that our foster parent may be really able to target that can be written into our recommendations and assessment reports, and as clinicians working with foster parents. Some of these are really typical things we want to do: supporting our foster youth in self-advocacy, rewarding assertiveness, identifying their interests and getting them involved in cultural and social activity, including really thinking about what are the meaningful traditions in their own families and getting our foster families to help support them continuing those traditions in their own lives. There's some research that really indicates that these can be very impactful ways of promoting a sense of well-being and of self-valuing that underlies successful performance of some of these other skills that we really want to support our youth in building. I'm keeping track of the time, and I want to leave some space for questions. So just be aware that there are some suggestions for things that we can include in working with our educators and mentors, as well as some of the advocacy and policy level work. And I really want to emphasize, if you work in any capacity with foster youth and transition age youth, you are an advocate, if only within your own system. So if there's anything that we've talked about or that I've said that you thought like, wow, that is just not possible because of funding or workload or administrative expectations or whatever, those are targets for advocacy. Those are places where you can work in your own system to make a difference to better support our ability to engage and support our transition age youth. And one of the most impactful things we can do is also to make sure that we gather program evaluation data for what we are doing with our transition age youth, and making efforts to engage funders and those who are part of our programs about the importance of follow-up data and of disseminating findings, seeking to establish some of those researcher, practitioner, funder partnerships that can bring together a variety of stakeholders, and that includes our COEs, right? This was a lot of information. In some ways, I think it really highlights the information we don't have and the barriers that exist. If I had to sort of pick key takeaways, they would really be starting transition planning early and often, assessing not only those really concrete independent living skills competencies, but also the status of our kiddos' assets, social supports, those intangible things like hope and purpose and flexibility when planning for transition, engaging youth in their own plans, and really doing so from a stance that's strengths focused, future oriented, and also honest about the fact that there are very real barriers that exist. Building in pro-social activities for our kiddos and youth that really create space for those natural mentor relationships to be identified and developed at least as much as we're getting our transitioning youth involved in formalized mentoring and support programs, and really supporting each other in our different roles, because we, all of us, are a team with clinicians, caseworkers, birth families, foster parents, GALs, educators. we have to do our best for these kiddos, and the best way for us to do that is by engaging with each other. So as we reach kind of the end of our time today, I'm wondering if anyone has any questions that they would like to address.
There were several questions posted in the chat, and I'm very happy with the chat. There's been some resources that have been shared, and I think I'll find a way to save this so we can send it out with the PowerPoint for those who asked. Some additional programs that came up. I'm sorting through this now to see where the questions were, because there was some just wonderful chat there. There was a question about how can just a few minutes ago about in practice, how can a DCS case manager really do this? I found most to be juggling too many cases in order to provide minimum coverage.
Yeah, I mean, I think we know there's a huge gap between what our best practices are and sort of where we are in what our systems can handle. And in some ways, maybe not a satisfying answer, but advocacy and systems level intervention is a big part of that, and getting really vocal about the links that we see between these factors in our caseworkers' lives and caseloads and the outcomes that we have for our kiddos. But also, I think having really honest conversations with our caseworkers from a place of, we know that this is a ton of recommendations. What's important here? What does your time look like? What can we do to streamline this, to make it easier? Where are the priorities? We often at the COE here will, in an assessment report, provide our recommendations really based on, this is the most important thing that you need to do. And I do think that there's a tendency to do that based on the really concrete things. And so thinking about the research, what are one thing from the rest of this data that we can provide? This is how you do it. This is who you call. This is the form. Here you go. And now we've just taken a ton off of the plate of the caseworker and helping to make that happen.
There was another question that came earlier from Stacy about additional services available for youth who are lower functioning that age out. And I think you talked about that a little bit about the under the impairments slide.
Yes, and I'm excited. I just downloaded the chat myself. I'm excited to see what some of these other programs are. I think we never have enough services, particularly for our very complex kiddos who maybe have those difficulties and deficits and also have, for example, a juvenile justice history or something like that, which can often keep them from being able to access some of our housing and other options, right? Because all of these programs that involve housing generally also involve background checks, DCS checks, all of that kind of thing as well. And that also affects our kiddos with severe mental health problems that might include sexualized behavior problems and things like that, right?
Excellent. And the question that just came in is, what is the rationale for having youth opt in to the transitioning services?
I don't think I'm the person to answer that question because I don't think it makes much sense myself. I do know that some of what I've read is very sort of predicated on the idea that if you opt in, you're more likely to be engaged and enthusiastic and maintain. Very much the same rationale that we use in saying that people need to pay for therapy, and that people who pay for therapy tend to be more engaged and active than people who are not paying for their therapy, right? The flip side of that is that there are a couple of small studies that suggest that we might actually have better outcomes overall if we made it an opt-out program rather than an opt-in program. So all youth who are aging out of care are assumed to be entering transitional foster care or extended foster care. and then they have to deliberately choose to exit that.
Excellent. I'm going to pull up the chat here. I had to close it myself. What other questions do you all have for Amy as we wrap things up here? Well, if any come through the chat, we'll get to them. Just a couple final things here real quick, everyone. First off, we want to thank Amy Gorniak for joining us today from our sister COE in Nashville. Also, if you'll notice, there's a link in the chat box right now for a survey. That's the link I talked about previously. I encourage you all to please click on that again and send it out to us. There are some questions about slides. And again, just to reiterate, if you'd like a copy of the slides, please email us at coe@utmck.edu, or you can email our administrative assistant, Karen Gray, KS Gray with an A, at utmck.edu. Also, I'd like to invite everybody and give a coming attractions for next month's Learning Cafe by our very own Dr. Caleb Corwin, Adverse Childhood Experiences, the Importance of Assessing and Addressing Trauma. And we will send out Zoom links for that after registration. So thank you everyone again, and we look forward to seeing you next month.